at home. So we are here from Sakra Hospital, a team of pediatrics and psychology, child psychology department, to make sure that we have some discussion and some understanding about what children are facing during these COVID times. So as all of us know, the whole thing started somewhere in November, but then it catapulted to severity by January. That's when the WHO declared it as a global emergency on 31st of January. And then after that, by March, mid-March, around 20th of March, the government of India announced an official lockdown. From then on, we are in the fourth phase of lockdown. So lockdown appears to be a simple word, which is like say, which is a catchy word, but at the same time, we have to understand what's going on within ourselves, within our families, within our offices, or about our health and about our well-being. So much is told about what it does to adults, and we are all aware of what happens to what are the symptoms of adults and how to handle it. And by this time, we have also gone through work from home, the effects of work from home on our working pattern, our family patterns, and our psychology. But we often think that kids take care of themselves. They don't need any special attention about these things, and there are no special needs for the kids. We provide for them. So what is there to worry for them? We have to worry about our job security, our EMIs, and everything. But what do they have to worry? We take care of them, so they don't have much to worry about. But we need to understand that we as kids, if we just go back a little and remember what we used to do at that time, whenever our parents came about half an hour late, we were worried from their offices. Like say, those of us who had two working parents know when our parents came half an hour late, we were worried. Whenever our parents were sick, we were worried. God forbid, by any chance they were hospitalized, we are more anxious. So because they are the whole and soul who are our focal points. So now a lot of things are going on in our kids' minds about what Corona is, why we are supposed to be locking down, what is this, why we have to wear masks, why we have to wash our hands all the time, and what can happen to us. And by this time, some of the common sense knowledge has already trickled in, saying that it doesn't affect kids so much, and if it affects it, it's affecting the parents and the grandparents. In that case, they are equally worried about our health, because again, they are sensing a lot of insecurity about what's going to happen to their parents, their family members, and their elders. Are they going to lose somebody? So these strong fears are there, which they cannot articulate because they are not expected to raise these questions. And when they raise these questions, we often say, give some passing answer and start it out saying that, okay, you don't worry about that, we'll take care. But then, are we happy if somebody gives us an answer that you don't worry, I'll take care? No, we want an explanation. So do kids. So that's about the psychological part of it, which Dr. Jamuna and myself are going to address a little while. And then apart from that, there are a lot of other things in terms of what we can do to ease their anxiety, to help them to cope with the present situation, how we deal our closed home situations wherein all are under the same roof all the time. So it's important to keep ourselves active, healthy, with good demeanor, and make sure that we don't trouble each other and help each other to progress in our particular fields, in our specific fields. So with that, we have brought out some important aspects of how Corona can affect our physical health, psychological health, in particular focusing on the kids and how we deal with it. So with this short introduction, myself, Dr. Jamuna is our clinical psychologist. She specializes in child psychology. And myself, I'm Dr. Ravi. I'm into pediatrics and neonatology. So now we'll go ahead with the presentation and a small discussion. Midway, if you have any questions, you could raise hands and you could post it. Then I would keep it to, probably I'll keep the questions to the end of the conversation. We'll address at the end of the conversation. Midway, if anything, you can put it on the chat box. Okay. So this presentation has been designed with kids in mind. So probably you could have your kids next to also, or we could share with them later on also. Okay, so broadly, we are going to address these points: physical and psychological well-being of the kid, small tips on child nutrition, how we plan their activity to keep them mentally and physically active, a few tips for the parents, and what to do about the routine vaccinations and immunizations of the kids, and how to seek medical help, when to seek medical help, and what are the danger signs and how we approach the doctors or the hospital safely without compromising our own safety and our kids' safety. So all of us know about these points which we just mentioned, coronavirus and its progression over the last few days, last few months. So in simple terms, it need not be a scary introduction to corona for the kids. One thing we need to understand is kids are kids. So the corona is scary, as we have understood over the last few days, but then we also have to keep in our mind that over the last 4 months, for the intensity or severity of the virus, with the effective lockdowns and with effective prevention strategies, our understanding and our government's efforts on making us understand these things, we have been able to control it quite well compared to the developed nations. So in that case, if we follow the same rules for the next few months to years, we don't know how long it may take, we will definitely be able to, flatten the curve as it is been suggested. So kids also are very effective participants here. So we need to tell them in the way they can understand, in the way it's not scary for them. At the same time, they get a good understanding of the whole problem and they contribute their bit without getting anxious in their minds. So corona is a word which you must have heard online or TV or in schools. So basically the word means a crown. So the shape of the virus is like a crown with some spikes at its ends. So it's termed as coronavirus. This has been there since a long time, but then there are different variants of coronaviruses, like we know SARS, MERS, and now presently COVID-19, which has been named based on the appearance in 2019. In some parts of the world, it has made a lot of people sick that we are aware of, and now it's entered in our country, and it's known to have a community. The community spread of corona was only noticed first during the, or rather, it's been legally announced that it can spread from man to man rather than from animal to man, only in late February. So from then on, these efforts to stop it with masks and with quarantining, all that has been happening stringently. So that has helped a lot. What are the symptoms of coronavirus and how does it affect kids? So a lot of the symptoms are similar to that of flu as it has been seen in adults. Like it can have a dry and itchy cough. Only difference from flu here is the cough here is dry and itchy, but in flu it's more of a secretory cough with a lot of secretions in the eyes, running nose, and sneezes associated with that. But here it's a dry, itchy cough with a fever, which can be variable in severity, and also the kids may find it difficult to breathe like in adults. But most of the kids can also have atypical presentations. Many of them may be asymptomatic, though they have the virus in them. And overall, it's been termed that it's milder in the kids, and a lot of the kids are affected very mildly. But nowadays they are seeing something called as the severe inflammatory syndrome in kids also, but they have not been able to 100% attribute to the kids. So in other words, we have to be very alert about what symptoms we see in the kids in the next few days, not to panic, at the same time not to neglect. So if you see any symptoms like a fever going on without any known cause, which is not responding to the usual medications what your doctor prescribes, and it's running for more than 2 to 3 days time, or you have associated symptoms of loose stools, tummy pain. Tummy pain is found to be one of the very important symptoms which can suggest severity of sickness in kids. And any other symptoms, unusual symptoms like headache, kids rarely complain of headache. So any symptoms like headache in association with fever or tummy issues, better we consult the doctor. So it is not all that simple as to pass it off as saying it's very mild, and at the same time it's not very dangerous to scare ourselves or our kids about this. So an alert mind from the parents with a keen eye for these symptoms would be helpful in picking up early so that we can handle it early. And also, as soon as you notice these symptoms, keep the kids in isolation, so that isolation with the parental support, with all the emotional support what you need to give, so that they don't pass it on to elders of the family or other kids around. So when you tell these information to kids, make sure that it's in a child-friendly manner, which is not scary for them. So that being the case, they would be very interested to know why kids are not affected and who are affected. In that case, it's much older people who already have some health problems who can get more sicker here. And they are often worried about their dad, mom, and grandparents. So you tell them that, yes, they are more affected, they are more positive, there are more chances for them to get infected. But at the same time, since we are all aware of the symptoms, we can immediately consult the doctors or take medical help. And once we are in the right hands, we can handle it safely for ourselves and for our community. So rest assured that we, the parents and our systems, are doing best for the protection of the kids and the family and the security, and the life will get back to normal as it was earlier, or rather better than earlier, because now we know the problems we had created for ourselves, which we are avoiding now. With all the, also we could also tell them the good news that the nature is rejuvenating itself. We are seeing a lot of wild animals, a lot of forests rejuvenating. So all the man-made hazards are evident now, and so we could even add to the picture to them to understand about environment and how corona is in a way impacting on that. Coming to what else to do, where to get the information. So we often, what are the sources of information? Most of us, if we ask, where do you get information about corona? WhatsApp, one thing. Facebook, for people who are active in Facebook as well. Otherwise, news channels which are time and again putting the same things in a very scary way or an emotionally impacting way. Even an adult cannot take off the news which we have got through a spicy news channel 4 days back from our minds. Then let alone kids. If you see the kids going through these things in their mind, if there are so many cases, nearly at least 1/4 to 1/5 of the cases, whatever has been told, so many times we have gone through the same thing in our minds. It is not necessary to run through the same psychological trauma for ourselves and for our kids time and again to understand the scenario. Now we have to get the news from the news channels to understand the scenario. Yes, we have to get it. And we can get that from reliable websites like government websites, WHO, UNICEF, to an extent CDC, which can give a picture of what's going on in the West, and NHS, National Health Systems of UK. So these are some reliable websites which gives reliable numbers, reliable ways to handle it, and even they address how to help different segments of the population, be it a specific sick segment or a specific section in terms of kids. And also there you will find a lot of parent-friendly or patient-friendly handouts as to how to address individual scenarios. So I think we should cut down on the amount of time we spend on the media, TV, and social media to understand this problems of corona, and we should stop contributing ourselves also to the junk what is there by trying to verify the facts and then behaving responsibly in terms of how we can mitigate the psychological uproar that's happening about these things. Of course, corona is a problem, but it's been to a great extent understood, and we know how to handle it. And all that we require is a 2 to 3 meter distance to keep it from spreading from one person to another, and that's not a big deal compared to what our understanding goes. So, and some simple measures like hand washing. So these things has to be told in the realistic sense and a responsible way so that kids follow that. And what are the other source of information? They may get information from somebody in the class. Now, of course, not in the class, but of course, online classes have started. So make sure that they get these information from reliable sources and be prepared to listen to them and answer their queries calmly so that they don't get an inhibition to ask the questions to us. Okay, next, coming to the kids, again, one more thing, they will also be wanting to help us in containing this, how they can contribute. So we should put their efforts what is required for us. Like for example, washing hand. What are the steps a kid need to practice to understand to help in the situation? Wash hands. Washing hands is important. Washing for at least 20 seconds is important, but making that as a obsessive compulsive scenario is not important. Washing hands to the extent of causing the hand eczema is often seen. We have seen a rise in the hand eczema cases these days. So one simple suggestion for that is hand washing should be kept only to 20 to 30 seconds, and then immediately dry it and apply a good moisturizing cream, whatever you have. And also specific scenarios when you have to wash hands and when you have to stop. So these things have to be told to the kids. And of course, it should not be undermining the importance of hand washing when we tell this. Coming to the spread in and around, when simple terms, they have started to play a little in and around our houses. So now we have to tell them how to stop spreading to the neighbor or immediate neighbor of them. So some simple terms will be sneeze into your elbow and prevent the germ from going into the air, so that they stick onto your elbow clothing, and then as soon as possible come and change the clothing, or use some disposable tissues which has to be disposed of very sensibly, very responsibly again, and don't allow it to stick around everywhere. And one more thing, what our BBMP employees are now seeing is lot of masks which are thrown. So we have to understand that there are some specific set of people who are exposing themselves to these hazards to protect all of us. If the BBMP people don't clear off these stuff properly, then we are in a terrible mess about increasing in cases. We all know how anxious we become if we see any quarantined person within our radius. In that case, how do we expect them to pick the masks which we have used and thrown? So it's important that we dispose of the masks very safely, in so that we don't create a hazard for ourselves and our neighborhood and community. And then kids should be told about what else to do. So don't meddle with your nose, no meddle with your face, nose picking, mouth touching. So these things has to be avoided. These are places where the germs can enter our body. And also you can have a small scoring system on our home, wherein, like, say, it's not like a pinpointing their errors, but then if I touch my nose, I lose 1 point. If you touch your nose, you lose 1 point. So that becomes a game also, and it turns into a habit also for kids, so that they enjoy the game part of it. When they are at home, they are in communication with their parents, and they are also participating. They are also understanding how to deal with corona. So there are a lot of helpers out there. So we should encourage our kids to be a little understanding of who all are there to help us out, so that they get a sense of confidence and also a sense of involvement and gratitude. These things will help for them also to participate actively in the community. So in the whole course, we should understand the importance of the family life and getting well with the kids, giving them proper family security. We have an opportunity which we wouldn't have in the last 4 months back. We have all the time to teach our kids, to understand our kids. So I'm sure that many of us are trying to teach many things to our kids by ourselves. Like, say, we may be trying to give them a concept in mathematics, or we may be trying to read stories with our kids, and we may be trying to play some home games, like, say, board games with our kids, be it carom, just whatever it is. So that way we are all actively involving the family. So kids actually are enjoying that. So our constant endeavor should be within the micro environment, what we can do to increase the psychological well-being of our kids, and at the same time keep the learning going on in an informal way, without stressing them, without stressing ourselves. So a few tips for how to explain the whole scenario to the kids: ask open-minded, open questions and listen to them. Encourage them so that they can ask questions. And we cannot block the whole media for them. So we cannot completely block them of all the media exposure, but we should explain it in a honest and a child-friendly way. Reassure them that we are doing everything for yourself to be safe, and also prevent them from stigmatizing somebody who is, like, say, for example, we often see people getting stigmatized about having a patient who has a cold. If somebody has a cold and a cough, people are starting to isolate them. We healthcare workers are also seeing some amount of distancing from the people. So these are all spreading of stigma. We have to be sure that we don't, again, time and again, the government also is spreading the message that isolate the disease, not the person, keep the disease away, but don't stigmatize the patients. Tailor the conversation to the age of the kids, and genuinely involve in conversation with the kids, and use authentic, non-dramatizing sources of the media. And also we should know when to cut off the information. Going ahead in the same line of thoughts, so much of information, so much of deaths all around, everything has been highlighted. But if you see the mortality of the world or the nation, the accidents and the accident related deaths have come down, and we are not seeing so many communicable diseases because of our improved management of our own hygiene at home. We are not seeing people have so many days not come to the hospital. Does that mean that something has changed? Why have they not come? Are they not coming only because of fear? Of course not. If their child is really sick, they would reach out in some way. But we see that the whole visit to the doctors or the healthcare system has come down to a significant extent for a few reasons. One is, at home we are taking care of measures to stop spreading any infection. We are doing for corona, but it's preventing all respiratory infections from spreading. So we don't see upper respiratory tract infections as frequently as we see. We don't see lower respiratory tract infections. We don't see diarrheas because of hand washing. Hand hygiene is taken care of. We are not seeing so many diarrheas. We are not seeing minor infections which are very often seen. So all these are the good points which this isolating symptoms have taught us. Thirdly, and next point, we are not eating from hotels. We are not eating from outside unknown sources. So naturally, the junk foods has gone down to a great level. So here we have to make sure that we continue these habits, what we have learned, which are helpful for our whole life, like avoiding junk foods, encouraging healthy eating habits with the kids, discuss what you are eating so that they know the caloric value, nutrient value, junk value, and the protein and vitamin value in the foods. So that these things can be carried off throughout their childhood also, and they are also better off in their own health. Junk foods has come down significantly, so these are the good points now. So with this being case, only the negative symptoms need not be highlighted. Though all said and done, at the end of the day, we probably see how many cases are there in Bangalore today, how many cases are next to me, and what happened to which are the nearby places wherein they have identified. So anxiety is a natural outcome of such a sudden onset of a pandemic of this range. So it's normal for you and me to feel anxious, and so it is normal for kids to feel anxious also. In that case, when is it abnormal? The abnormality is if it's affecting my daily functioning. I'm not able to do what I'm doing. So then it becomes an overwhelming problem with the symptoms of what has been depicted in a simple way, like say blurred vision, flushed cheeks, dry mouth, shaky legs and hands, sweat, stiff muscles, and tummy discomfort. So these are a few of the symptoms. And in these things, you recognize that you or the child or whoever it is have an anxiety which is beyond what is expected, then address it. So how do we address anxiety? Understand the facts, take away the myths, follow the advice. So there, if we do what we are expected to do in this scenario, we are safe. That is what is the primary thing. I don't have to know how many people have suffered in France today. What's important for me is think locally, act locally, so that I'm not unnecessarily overburdening myself or my kids with unnecessary information to the extent of paralyzing our day-to-day work. So follow the advice given by the government agencies or the national agencies or some websites like Indian Academy of Pediatrics. These are some of the resources which we can look to keep ourselves, or psychology associations. So these are some of the resources which we can rely upon without upsetting our daily routines and rhythms. So here, anxiety is just a normal variation. All of us, if we are not even concerned about what's happening, that is too little stress, we are inactive or laid back. And if we go beyond a certain level, wherein we are, then as the curve shows, it after a certain level of stress, we start to improve our performance. If there is no exam stress, we know how well we study or we prepare or our kids study. So that is the optimum level of stress which is required for us to perform well. Beyond a certain point, it turns into de-stress or overload. That is when exhaustion sets in, and the same thing, which if it progresses a little longer, we will have a panic attack, anxiety, and even a breakdown. This leads to burnout and unnecessary excess stress. So we cannot do away with stress, because stress is required for our performance, but at the same time we should know where is the optimal level, and we should keep it at that optimal level and do other things to de-stress ourselves. So here we know when we are stressed. When we are stressed, we get up, we go out, have a cup of coffee and come back, we shout on somebody, or we talk out to somebody. Unfortunately, kids don't have so much of resources within themselves to reach out to different scenarios. All that they can get to is their parents. And if as parents, when we are stressed, if they come up with an unhappy face, or if they come up with some anxious look with a problem in their mind, we just turn them off, saying it's okay, it'll settle down, don't worry about that, we are taking care. So it's no solution for them. So we need to take extra time and efforts to understand what's happening in our kids' minds. Give them a small facial expression chart and make it a point to ask, and don't make it as a not every now and then, but then at least when you feel that they're not doing well, what do you feel, what's happening to you? So emoticons like this may help us to understand what's going on in their minds and address it. So because once we really figure out what's happening in our mind, then is the time when we act. Otherwise, we don't feel that there's why should a kid feel sad or angry? We are giving everything. We are giving everything to play. We are teaching them. We are making them go to the best schools. We are paying so much of fees. We are paying so much of extracurricular activity fees. What is there to worry? Definitely, we are not addressing their emotion. We are not addressing what we can call as the right part of their brain. We are not allowing them to smile well, laugh well, spend their time happily with us. So these are the things which we need to cultivate and put into action so that the kids are made to feel comfortable. And also we know these techniques of mindfulness, meditation, and calming techniques. We can log into some websites, we can log into some resources, Art of Living, Sadhguruji, whatever. So, but we know how to calm ourselves when it is very severe for us. But at the same time, we don't know how to put it to our kids. There are some specific ways how we can reach out to them, like say some simple things, age appropriate techniques like count 10 or jump 10 times. Do some simple things like count the number of seeds or counting techniques. So many things, there are many techniques which if we browse a little extra and take care to customize it to the kids, we will be getting a lot of resources on the internet. We should be using those techniques to calm our kids, also teach them the virtues of or maybe we teach prayers. Many of us know prayers in our own religious systems. Then we should start teaching our kids also, because we know these are also relaxing techniques. So we could help our kids to understand these things. Next, with all these sources, when the kid cannot get answers from the parents, what do? Definitely they go to social media. We often see our kids googling out whatever they want. You want it or you don't want it, it is there. The social media is there, gadgets are there. Our efforts to help them is there. But the problem here is availability and accessibility to social media should not be more than the availability and accessibility to the parents. So when they have an easy source of information without cribbing or without targeting them, they will go for it. So social media will take them wherever it is, wherever it can lead to. We know where all it can lead to. So it's important that we don't get our kids hooked onto the social media, and we know where the limits are, and we have to exercise them with a lot of patience, involvement with the kids, so that they don't overdo that. And here it's just depicting one mother who is trying to pull her kid who is down in the social media. So these are the efforts probably you and me are going through every day in and day out. So to not get into that scenario, only ways, all that they are looking out for in social media is a sense of self-worth, a sense of understanding and confidence. So we have to make sure that our offline activities are favoring them. They enjoy the other parts of the house, other parts of the activities, games, studies, family time, involvement with siblings in a healthy way. So just the same things, what we can do to limit this: clean your feed, that is your social media feeds. Don't hesitate to unfollow somebody, mute somebody, block somebody, delete somebody. Avoid using the gadgets passively. That is passivity, meaning when they are about to sleep, when they are just woken up from the bed, or when they're eating time. These are the times when it creeps in. So these are not the times where, these are the free mind times wherein they need to just gaze around. They need to just allow the mind to be resting there, and also tell them what they can do in the other times. Guide them to be physically active, and Dr. Jamuna is going to speak a little more about that. And then, so these are some important tips which we can do to them. So what are the simple routines? What are the simple things which we can help our kids to understand? Get a good sleep routine. Sleep early, wake up early. Sleep early, wake up early. Don't unnecessarily do a lot of things during the sleep time. Don't get anxious. Don't do COVID discussions at the time of sleep. So keep them calm around the sleep. Establish a good sleep rhythm. They can also connect with the nature in and around the gardens. Put them into some static physical activities like yoga. Yogasanas are very good in terms that they can stand there and do. We can teach them yogasanas or aerobics, skipping, simple standing games, hula hoops. So these are some of the ways kids can be active. So that was about the activities what we can help them with. Coming to the nutrition about the kids, it's not anything other than normal. Whatever the baby food guidance, what we routinely have in our minds is the same thing. There's nothing new here we have to do, but we have to focus on the nutrition because we are preoccupied with so many other things. We have to work from home, we have to prepare at home, we don't have easy resources. Our maids are not there, so we have to work, we have to do office work, homework, maids work, babysitting work, and school work. So it's not easy. So our mind can easily go off the nutrition as an important aspect, and we can go without food for quite some time. That will be kind of a fasting or whatever the healthy fastings for us. But the kids need regular food and regular nutrition at the right times. So please earmark that, clearly mark the times when the baby needs particular foods, and have have it well procured at home so that you can don't stock it unnecessarily though, and revise the healthy food concepts again so that we know what they need to get, what they shouldn't get. Some fruits, vegetables, grains, whole grains, these are some healthy baby foods. In the same way, when it goes to the next level of toddlers, encourage self-eating, encourage healthy home food eatings. They should start to eat themselves, avoid junk foods. Anyway, luckily we don't have much of access to junk foods, so encourage that. Again, the same concept, a little reinforced with the kinds of foods, vegetable group, fruits group, meat group, milk and vegetables. Encourage the healthy eating habits. And of course, this again, our government of India's Food Safety and Food Safety Authority Institute has framed some standard guidelines, which has made the schools, which has prohibited the sale of junk foods within about 50 meters from the school campuses. That's very good. When the government has done so much to disallow junk foods 50 meters from the school, we should not get it anywhere near 500 meters from our home. So we should make sure that we take this very seriously and avoid junk foods to our babies, our kids. So that's briefly about the nutrition for kids. And coming to the next aspect of healthcare, here we have to understand that we have seen a steady increase in the under 5 survival. Kids who are less than 5 who would survive in 2008 was much lesser than what they are surviving now. So under 5 mortality rate, which was 68 per thousand, 67.9 per thousand in 2008, has steadily come down to 36.6 per thousand. So this is a tremendous improvement for a 10 years range. How has all this been achieved? This has been achieved with not by great medicines, not by great investments in healthcare, but it's by simple sanitation, proper sewage treatment, adequate treatment of drinking water, safe access to drinking water, food hygiene, proper garbage collection and disposals, proper housing, and understanding of nutrition. These very things are getting compromised in the present scenario. We get our water from the nearby tankers. Have we ever made any effort to see where they pump that water from? We don't know. And we get our vegetables from the nearby gardens. So do we know how it's grown? Do we know what is the source of water for that? Is it not from our Belandur Lake or Vartur Lake? We don't know. Or how do they water those? What are the pesticides on that? Have we made any efforts to look at that? So these are some things which are getting compromised. So these are the causes of a lot of ill health. So we should not take our focus out of these with a preoccupation to COVID and Corona. We should have our holistic approach to the health as we had earlier to improve it steadily. And we have to make our sustained efforts on our hygiene standards. And so these things should again be focused upon. Next, coming to the vaccinations. Not to undermine the vaccinations, because we have achieved some important steps in the public health. So our freedom from smallpox, polio, tetanus, and rabies are all because of vaccines. We haven't seen smallpox, polio is India has eradicated polio, tetanus. All this is mainly because of vaccination, and a host of other diseases which had for centuries troubled our country or the humanity, like TB, measles, mumps, rubella, hepatitis A and B, diphtheria, pertussis. These are a few of them to mention. So vaccinations definitely has to be done. So there are very clear directives from Indian Academy of Pediatrics and WHO that routine immunizations for kids should not be stopped, and we have to make access to that, and we have to make it safe, so that we have to make it safe with all the precautions, but don't stop the immunizations, continue in the safe way. So there are a lot of predictions that vaccine preventable diseases can go up after this lockdown and unnecessary scare from reaching out for simple. Of course, we have to be cautious, but at the same time, we should take precautions and get our vaccinations done in the safe, reliable places in a reliable way. Like, you take your precautions to come to the hospital, make sure that the hospital you're going in has all the precautions to protect you from healthcare. They are using proper techniques and also not compromising on the safety. You have the doctor and the staff next to you when the vaccination is happening, or rather in the scenario of the hospital. So we have to understand these important things. We should get our kids vaccinated at safe places safely, and we should at the same time keep ourselves and our families safe from the virus. And then coming to the vaccine for corona, no, we haven't got a vaccine for corona yet. A lot of investments and a lot of work is going on in this direction all over the world, but as of now, there's no vaccine. Coming to medical help, so there are some specific ways we can reach out to the healthcare system. Teleconsultations have started very rampantly all over. So it's one way of seeking help as and when it required for any simple things which can be handled on phone, or for any simple fevers which requires ourselves from getting isolated. But at the same time, it may not be so much. You go to any healthcare system with a fever, the healthcare system would not be comfortable taking without screening for COVID. At the same time, most of the fevers are not COVID. Most of the fevers are simple viral fevers which can be handled. So telehealth, teleconsultation, keeping in loop with the health system, at the same time keeping ourselves safe from getting infected, would be a very reasonable option for the next coming few months to years maybe. And clearly make sure that whenever you any hospital or any healthcare system you go would want you to state your COVID contact history and what zonal risk you are in, so that both the parties are safe in terms of transmission of risks of the virus. And if we follow the appropriate protocols, be it in the hospital, be it in the house, be it amongst ourselves, we are quite safe. These are all designed with a lot of studies all over the world, because luckily the health systems all over the world are quite strong, and they're spreading the information what they have gathered, so that we can take early precautions, which we are doing now. And once we are sure we are not dealing with a COVID case, and if the fever or whatever symptoms are escalating, if it is, God forbid, if it is increasing, the doctor may call you for a clinical examination on requirement basis. So that way we should make sure that we take medical help for what is required, and don't neglect things, don't allow for some simple illnesses to go higher. One reservation here about the doctors is that doctors are not wanting to do much of throat examination. We can get the same information what we get from throat examination by simple examination of the lymph nodes and other things. So most of the doctors would not be inclined to do a throat examination for kids or for adults as well. So these are some simple things. And from at home, what we can do to protect our health: take good nutritious diet, take a lot of liquids, take a lot of rest. When to visit the emergency room? This is a time wherein we don't have a choice. When it comes to manageable illness, yes, we do manage at home or with medical consultation, but emergency room visits are a must when it is required. For example, look, if the child looks very sick, definitely we cannot rely on telephonic consultation at that time. Has some breathing difficulties, like say baby is breathing very fast, or there is some rib pulling happening, or a lot of effort on breathing, or if the child is disoriented, confused, or very drowsy, sorry, or the child has a chest pain, or you see that the skin is very cold, clammy, and mosaic pattern of blotchy skin, or you see some rashes, these are things which require medical attention. So these times, or in kids, often we see ingestion of things, like say at home they have access to all the things. It could be naphthalene balls, it could be any simple things which they are getting their hands on. So these things has to be kept away from kids. Coming to the so these are some simple things which we definitely have to visit the emergency room, but make sure that you go to a place wherein they have all the necessary precautions for COVID in place. They are using PPEs, which are very important, effectively, and they are disposing the PPEs correctly. Make sure that they have the segregation of suspected COVIDs and general population are not mixed. They have a separate entrance, or whatever. They have adequate measures to prevent the emergency visitors from getting infected with any other infection, in particular with COVID in consideration. So coming to the treatment, what is COVID? COVID is a viral infection. So it causes infection, it causes mortality, we know that. But then most of the people with COVID-19, including children, do not have a serious problem, and they do get better only with rest and fluids. But to prevent ourselves from being health hazards to others, we should quarantine those who are infected. People who are very ill needs to get hospitalized for IV fluids and better care and other treatments with help of breathing or respiration as required. But as of now, we have to take precautions and be safe. we all know about hydroxychloroquines or HCQs, adults, and that has been being in social media also for quite some time. But what we have to understand is there is no role of these medicines in kids, and it can be dangerous, it can be life-threatening. So please don't use these medications by yourselves. And also you discuss a lot with your doctor if anything of these medicines are prescribed, so that you understand what's going on. So coming to as where we at Sakra are managing these whatever the steps we discussed, we are taking care that we are doing a lot of teleconsultations. We are open for teleconsultations. We are practicing social distancing. We are isolating corona patients. We haven't got one still, but then we have all the systems in place to handle if need be. And we are also screening whoever comes into the hospital for corona. And of course, the cleansing, the hand sanitization, the floor sanitization, surface sanitization, everything has been practiced very stringently with state-of-the-art protocols. That being the case, yes, any questions you feel needs to be answered, you please put it on the chat box. We'll address that.
Hello everyone. Myself, I am Jamuna Kakarla, clinical psychologist working on Sakra World Hospital. So today we are here to discuss about how the mental health of the children during the lockdown. As we all know that we are facing a lot of uncertainty and we have a lot of time, but we don't know what to do and all. So this indirectly affects the child mental health as well. As we all know, this physical interactions are very, very important for physical and emotional development of the child. Now the restriction has been cut down. So now we usually don't know, and we usually face some of the issues. So we are here to address few of the issues and the tips to overcome mental health issues during this lockdown. So the topics today we are going to discuss about is main challenges for children due to lockdown that they usually face, and the stress points faced by parents. Yes, now we know that children are at home, and due to which the parents also face some of the stress, and how to manage these stressful events. Tips to take care both physical and emotional needs of children. So there are some myths and misconceptions on COVID now. All over the news are spreading widely, and some of the activities for age group 6 to 10 years of children that to follow at home, and toolkit for age group 11 to 19 years. Some of the activities that we are going to discuss today. So now, if we look into it, what are the main challenges for children due to this lockdown? Yes, most of the time they are stuck around at house, so they are widely missing a friends and wider family. Yes, they will be having a lot of plans for summer and vacations and all, so they are obviously going to miss that. And lack of interpersonal interaction. So now children are not allowed to meet neighbors also, or the extended family over there. So they are widely restricted, and then interaction also has cut down. The strain of being with the same people 24/7, they are stuck with the same people, seeing around the same people and dealing with them is more strenuous. Losing their regular routine. Yes, earlier schools were there, they used to follow some sort of routines. Now that has been cut down. So there is no proper routine, and it is very much stressed out. So limited learning. Yes, so they are not going to school, and obviously learning also has cut down. Now, when we look into a parent's perspective, what are the main stress points for parents to deal with these children? Yes, obviously, working parents, they're all the time at home, but they really cannot give all the time to the children. And parents are worried about their job security. Obviously, parents also do face some sort of uncertainty related to a job, and that also stresses them. Some of the domestic chores may have increased because everyone is at home. Yes, so 24/7 they are at home, and obviously the chores have increased. Increased sibling rivalries. Dealing with children frustration and anxiety. Dealing with adolescent overexposure to social media. Yes, this is a major stress point for the parents to how to get them out of the gadgets. And parents who are already suffering with a communication difficulty, because some parents, they don't know really how to address the anxiety of the children. So for them, it is even more difficult during this lockdown. Yes, when you know that children are at really stress, how do you have to basically deal with this kind of children? There are 3 simple techniques that you can follow and you can apply to deal with this kind of children. Well, first thing could be listen. Yes, so most of the parents, they really don't allow the children to talk. So you need to really give an opportunity to talk to children and encourage them to ask more and more questions. And comfort, how do you have to comfort the child? Yes, you can use a various tool to comfort a child, as in like telling a story, singing with them, and praise them frequently for their strengths. Reassure, so keep them safe and provide them with a correct information. Yes, so for the younger children, you need not necessary to give a overloaded information. You can make it as a simple and reliable information. All the time you can visit a reliable information by some of the trusted websites. Yes, some of the tips to take care of both the physical and emotional needs of children. Yes, now this for the parents, it is very tough time. They really bother by like how to deal with this kind of children. Parenting is all about spending a quality of time that we say it, but how? So yes, some of the questions that comes to a parent's mind is that they really cannot go to work and schools are closed. Yes, it is normal to feel stressed and overwhelmed. It is absolutely normal. But if you look into a different perspective of this positive time that has given due to this lockdown, you can see it in a different perspective. Quality time is free and fun. It makes the children feel loud and secure and shows them that they are very important. So the school shutdown is also a chance to strengthen relationship with our children and adolescents. Yes, now you know that you have a quality of time. How do you have to spend this quality of time with the children? Yes, you can follow some of the tips here. Set aside a time to spend with each child so that every day you can just give it a 20 minutes or a 1 hour time that you can set it for, so that children can look up to forward to it. Ideas with your baby and toddler. If you have a baby or toddler, how do you have to spend time with it? Yes, you can also sing songs. Most of them have been doing it, but still you can also add to your list. Make a music with pots and spoons, copy their facial expressions and sounds, and stack cups or blocks, tell a story, reading a book, showing a old pictures. If you're really interested in connecting to virtually, you can connect with the grandparents and they can also tell us stories through virtually, and that can also be a fun. Ask your child what they would like to do. So this time, little bit differently, you can come up with and ask them that they can come up with what actually they would like to do. Switch off the TV and phone. This is a virus free time. Yes, most of the parents that I've been hearing that they will take out the TV, mobile gadget, whatever is there, but they really don't engage the children with something of the other. It is very important that we need to engage the child with something of the other activity so that they'll feel less stressed. So ideas with your younger child. If you have a younger child, you can also read a book and look at pictures, go for a walk outdoors or around the house, and play dance and freeze. You can play indoor games and do a chores together. As we have discussed earlier, the chores have been increased. So it is very advisable everyone at home that they involve with the chores, and you can also keep it as a responsibility for children, and whenever they do it, you can reward them. And you can also help with the schoolwork. Ideas with your teenager. Yes, so this is the bigger problem nowadays that they are all facing it, but there are a lot of things that you can do to you or spend a time with your teenager, that talk about something they really like, and try to understand their strengths and weaknesses, or what TV shows they like, and whom they are really friends with, and something. Go for a walk outdoors around the home and do workout together. Yes, next thing is like parenting, keep it positive. Yes, how do we have to be positive this time where the children are driving us very crazy? Yes, it is hard to feel positive when our kids driving us crazy. We often end up saying, stop doing that. But children are much more likely to do what we ask if we give them the positive instructions and lot of praise for what they do right. Yes, how do you have to like keep it really positive? Here is that some of the tips. Say the behavior you want to see. Yes, make it clear. Use positive words when telling your child what to do. Like, please put your toy away instead of don't make a mess. It is all in the delivery. You make sure that you modulate your tone and then tell the instructions. So get it real. Usually parents like sometimes due to the stress or whatever it may be, they'll be like sometimes unrealistic with the kids. So they expect some things that they really cannot do it. So check yourself on it and be realistic what they really can do it. So praise your child when they are behaving well. Yes, so this is the most important factor then and there, that you have to praise your child, and the child is more likely to repeat the same behavior again and again. So listen to your child's needs. Teens especially, so they may not be like more comfortable with discussing everything with the parents. So give some space to discuss some of their concerns with their age group people. The next thing could be parenting is all about structuring up. Yes, so now we know that this COVID is going on and we have missed our daily routines, work, homework or anything. How do we need to structuring up this? This is hard for children, teenagers, and for you, but making a new routine can help. So for that, what you have to do is that create a flexible but consistent daily routine. So here, why we have mentioned it as a flexible is that it can be always that you can include some of the activities or you can remove some of the activities. So check on yourself when you are making a routine, because some children, they really cannot follow it and the poor adherence happens, so that it needs to be revised continuously. It also one of the good thing that if you include your child making in your routine, so there is more chances that they adhere it. And you are a model for your child behavior. Obviously, we say that the behavior can be learned one, so they easily copy and model your behavior. So you can follow some of the practices for keeping a safe distance or whatever, hand washing or following a stable routine, so they model it. Teach your child about keeping a safe distance. Yes, so maybe we don't know, we are uncertain about how long this would go, and then already lockdown has been extended. So preparing them for like carrying these kind of safe distance would help, so that you can prepare the child that it is okay to miss a friends, and you can convey your regards or whatever the text is that you can convey through messages or writing a letters to others. Yes, so already sir had mentioned about the making a hand wash and hygiene is a fun. So 20 seconds is allowed for hand washing. You can make it more interesting by singing a song. And recently the advertisement is going on, like, which is a very inspiring one, how mother would show to the child to the germs will go away when she put her finger into a bowl. And at the end of the day, take a minute to think about the day and tell your child about one positive or a fun thing that they did, and which is a more reinforcing thing, they likely do it further. So next thing could be parenting. Parenting is all about honesty and openness when giving information. Yes. So we had discussed some of the parents, they have a communication difficulty. So now having a communication difficulty, how do you need to talk to a child? So you need to keep it as a very simple with a child when you are communicating. So always answer questions truthfully. So tell them early and talk clearly to them. Make a time for them to listen and understand and ask questions. It's okay, it's absolutely okay if you don't know the answer. You can together find out the answer. In that way, you can reassure the child, or you can also learn through it. Children may ask the same questions many times. So reassuring the children with a simple answer can give this child a calm and supportive way. So there are a lot of stories going on around. If you could really want to visit a website, you can visit a trusted website provided by the UNICEF or WHO. So which will be having a cue card which describes the proper stories to make them understand about what is corona or how it spreads and what it could cause and everything. So probably you must be aware of there are a lot of questions children could ask, and some of the question, why is the school closed? And what is a virus? Why do we need to maintain a distance and these things? Yes, so when it comes to, as sir had mentioned earlier, like talking to children about rumors related to coronavirus, yes, there are a lot of myths and misconceptions around this information. So the information that I'm going to now say, this information is not true. The virus attacks only old people and children and spares young people, not at all. The virus is transmitted through pets and people should be abandon their pets. No. The use of mouthwash, antibiotics, cigarettes, and liquor with high alcohol can kill COVID-19? No, not at all. Going for a steam bath outside in the sun can prevent you from getting infected with coronavirus? No. All food items are contaminated and will spread the coronavirus? No. There is no need to worry as Indians have higher immunity. Coronavirus does not survive in the warm and hot weather. Yes, so had mentioned about the online thing. Yes, now we have a difficulty to deal with adolescents. There are 5 golden rules I quickly tell about that you can follow before you allowing a child. So it is okay to block someone and don't accept a friend request from strangers. If it is an email looks suspicious, you can mark it as a junk. Passwords are not social. Don't share your password with anyone. Remember to log out while you are using a public computer. So few of the activities I quickly mentioned to engage the child 6 to 10 years, where you can create a printables with a messaging. Suppose if you can download a printable thing, how important is a hand washing, and ask the child to tag it. And infographic posters or worksheets, the poster will be having some of the symptoms as described or anything that you would like to carry out further. So you can show it to them. At the same time, you can give it an empty chit so that they can write it on their own. So if you have really questions and answers, so you can drop it and we will be responding through email.
Thank you.
Thank you.